Hey everyone, my name's Dr. Andrew and welcome to today's episode of the Chiro Couch. Now if this is your first time you've tuned into these videos, let me give you a quick rundown. Every week we do a short talk on things chiropractic and how it can help you. The goal is to inform you better, but also to spread the word about chiropractic and how it can benefit everybody. And it's not just about back pain. Now today we're going to dive into the world of subluxations. What are they, how they can affect your health, and more importantly, do they go away on their own? But first off, imagine these subluxations as kind of an electrical short circuit to your spine. And when one or more vertebrae in your spine move out of position, they create pressure and they irritate your spinal nerves. And this can affect your nerves' ability to send messages to and from the brain effectively, and it impacts your body, not just your muscles, but your organs too. But how do these actually come from? Well, physical causes like minor slips and falls, accidents, sporting injuries, improper lifting, most common one, poor posture. You can have emotional causes such as stress. It might be simple, but when you have muscle tension, it can affect your posture. Or it could be complex and it could affect your internal hormonal environment. And talking about that, chemical stresses. It could be difficult like hormonal regulation, or it could be straightforward as just poor diet or substance abuse. This will affect the way that your body's structure will function. It's just like putting bad fuel on a fire. You need good fuel to make your nervous system and spine work well. But the thing is, can you feel these subluxations? Well, they vary. The symptoms could be pain, discomfort, decreased mobility, even systemic issues like digestive problems or headaches. But here's the kicker. Some subluxations can be there for years without you even knowing that they're there. Sort of like a cavity hiding in your tooth. That's why regular chiropractic checkups are so important. So the burning question is, will they go away on their own? Well, I guess it largely depends on the individual and the nature of your subluxation. The simple answer is the longer you've had it, the less likely it will resolve on its own. While the body sometimes will heal minor subluxations through natural processes like stretching or exercise, many subluxations will need a chiropractor's touch to realign the vertebrae and relieve that pressure on the nerves. But it's not just a quick fix. It's about retraining your body, which takes time, especially those subluxations that have been there for a long term, and it could even have disc or joint degeneration associated. So that's why we give you recommendations based on the type of care you need. Exercises at home, lifestyle adjustments you need to make, or even simple things like your work setup that's contributing to your problem. Now, here at Robina Chiropractic Wellness Center, we use a variety of techniques, but especially we use a technique called chiropractic biophysics. And we're the only people on the Gold Coast that have this advanced traction equipment to effectively treat and manage those subluxations, we think, better than the rest. So in conclusion, while some minor subluxations can resolve on their own, most require professional intervention for long-term health relief. So make sure you get your chiropractic checkups to identify these problems and make sure they don't turn into serious problems. And think of chiropractic not just treating existing problems, but also preventing future problems as well. So thank you for joining me today on the Chiro Couch. Remember, it's not just about solving problems, it's preventing them. Stay tuned, we'll give you more insights in the future. Take care of your spine, and I'll see you next week on the Chiro Couch. Bye for now.